The conference is all about the role of protons in radiotherapy. Very controversial. Some people believe only 1% of radiotherapy should be delivered by protons. Others think 40%. The truth is somewhere in between. I think about 10%. I'm chairing that, particularly about the UK. Here we have a very peculiar system in that we've got 2 units being built by our NHS, Government Health Service, which covers 90% of the population, and 5 being built by our organisation, which is a private organisation with private sector finance from the city. Really, the whole question is what percentage of patients having radical radiotherapy for cure, would be better off having protons. And it's fascinating to see. And the range is enormous, but I think my own feeling is 10%, and therefore we need something like 18 machines in this country. And the same calculation can apply right across Europe and in fact around the world. That's the problem. If protons were the same price as photons, linear accelerators that generate photons, there'd be no argument. We'd still be here having a Proton Congress, but there would be no financial argument. And of course, it's not just radiotherapy. There are high-cost initiatives in pharmaceuticals, as you know. Some of the cancer drugs now are costing more than $120,000 a year. All healthcare systems are struggling. Cancer is predominantly a disease of older people. And the question is, how much can younger people paying tax in countries like this support older people who are paying less tax to have very high-cost interventions that may only be partially successful? It's a combination of both physical building, having capital, and also having the running costs, and also with high-cost drugs, actually obtaining the drugs. The problem for the NHS at the moment, it is really short of money. It is bust, basically, and I think we all agree, even the politicians agree. And there's no simple solution. You can't just shovel another few billion pounds into it, because where does that come from? Roads, teaching, education, all sorts of other things you'd have to cut. So the NHS is, of course, the religion of the British society, but I'm afraid we've got to have some radical solutions for it. I think within the next 2 years, if you look at how the world of protons globally are going, I think a lot of clinical data will come forward in the next 3 years. So by 2020, I think we'll be in a position to really evaluate at what percentage we want in terms of radical radiotherapy. And I think it'll be consistent throughout the world. The NHS is an outlier at the moment, but I think it'll come into line. The UK will come into line with Western Europe. We'll always lag behind the Americans, who are always over-ambitious and over-enthusiastic with innovation. And that's always been the way, and that's fair enough. But I think, well, by 2020, it'll all settle down.